Hi there, glad you could be with us on this Friday, and we thought being on the tail end of our outbreak here and with some new CDC guidance and new vaccine news coming out all the time, might be good to do one of our briefings, visit with Dr. Sanders, which is what we're going to do today for you on KLAM and KCDV. This is Friday, the 12th of March, and the daily briefing time slot continues to be open as needed, 1, 5, and 8 p.m. on the radio, plus the upload to youtube.com/Cordova TV. So let's visit with the doctor and learn some things here. So, doctor, the numbers rose and then they fell, and the chart says we're at about 4 active cases now, which is a lot better than 25 to 30. Reflect for us on the outbreak and how you think everything went.
Well, I think this outbreak gave us some excellent evidence that our mitigation strategies worked. We saw active cases on a Coast Guard ship. We saw active cases in our school, and we didn't have any identified spread within those areas where the internal controls and mitigation practices were in place. So that's excellent. We continue to see the cases decline, which is excellent. And I think that's in part to Cordova, as is everybody is very well rehearsed in how to contain this. So we were successful.
Good. All right. So what would you say, is there anything in terms of a major takeaway or major lesson that we should, end this phase with?
I think the takeaway is that the strategies are working. We still have a lot of vulnerable people in our population, and we have to be cautious with them. But it also gives me hope, and I'm glad that we had an outbreak like this later in the year once we have other controls in place, including a large number of our elderly population is already vaccinated, and the hospital is very well equipped. So, we're ready. We know that a lot of experts right now think that COVID-19 will likely become endemic, and I think that everybody is learning how to operate with this being one of the infectious illnesses that we are at risk of getting. And so.
Yeah, so for us lay people, when you say endemic, it's going to be something that circulates around like the flu each year, like colds, that kind of thing?
I think a lot of experts are starting to feel that way. Of course, it's yet to be seen. We'll find out over the next few years, but certainly possible.
Okay. So have you heard any talk? I mean, obviously everything's really early and it's all totally speculation at this point. Have you run across any talk that there will maybe be a push for an annual vaccination for this, the same way there is with the flu, or do they just not know yet?
Yeah, I have no idea yet. However, speaking of vaccination, I am really excited. Cordova is doing so well. I just feel so fortunate to be here in Alaska, where the distribution and the rollout of our vaccine has gone very smooth. In Cordova, we have at least 57% of adults in Cordova have started the vaccination process. So
wow.
We expect to keep getting pretty good size allotments and continue to offer vaccine for the next months to come. Next month in April, I expect that anybody in Cordova that would like to have a vaccine will be able to get on our schedule and be vaccinated. No
kidding. Yeah, I mean, when the last numbers I saw on the national average were like 10% of the population, and we're at 50 some odd. All right, almost 60%. So spectacular as always. We always seem to be on the front side of things as much as any community can be. Speaking of nationally and how things are happening, the CDC came out with some guidance that in some respects, it makes you go, oh boy, and in other respects it's kind of like, I don't really understand. So can you go over again, from what the new ideas were coming out of the main office there?
Yeah, so the basic idea is that fully vaccinated people can gather indoors with other fully vaccinated people without wearing masks or without physical distancing, and that would be low risk and a safe activity. And then they go on to describe other scenarios, fully vaccinated people with low risk, unvaccinated people, and helping to describe some of those risks. I think the take home message is that we're seeing people that get vaccinated are at a significant lower risk for shedding virus, even during that asymptomatic period. So as we see more people get vaccinated, the risk of that asymptomatic period is getting lower because that asymptomatic shedding period is likely very brief compared to an unvaccinated person that might shed for several weeks. What they say is that each individual should take precautions and kind of determine the characteristics of the unvaccinated people around them that they could potentially be exposing. And people get to make a little bit broader, feel a little bit safer in their decision making for gathering and not wearing masks. They do recommend, whether you're vaccinated or not, that anybody engaged in social activities in public settings should still wear a mask, social distance, and wash your hands.
Okay. Well, I mean, washing hands is always around. Social distancing, we'll see how that goes in the future. Yeah, it was interesting because the given the numbers we're seeing for the effectiveness of the vaccine, that the sort of relaxing of some of the recommended restrictions seemed a little timid at first glance. But of course, I'm not a doctor, so the concern is not so much. It has to do with still with the ability to even a vaccinated person possibly still being able to transmit it. Is that what why they're still being cautious?
I think, and also this is a broad guideline for the entire country, and we are very far ahead in our vaccines here in Alaska. So I think as more people that are at risk and vulnerable are protected, and we have more data on how well this vaccine is working, although the preliminary data does look excellent, I think that we will see more guidance coming out in the next few months. But for right now, it is people that are vaccinated can feel safe gathering with others that are vaccinated, can have some gatherings with younger unvaccinated individuals, if you will, per the CDC guidelines, and they can feel that that's also a low risk activity. And we can start having kind of that path forward to normal life and getting back to spending time with loved ones.
Yeah, I remember the specific, they were when they pointed out the mixing of vaccinated and unvaccinated groups, the lower risk, the kids for whom this is, if they do get it, it's, if I remember the data correctly, for a really young child, the flu is actually a more dangerous disease than COVID is. COVID just doesn't tend to be very hard on the younger populations, and therefore vaccinated grandparents, for example, being able to see their grandchildren again was one of the things that they pointed out specifically. So we'll just see, I guess, kind of how that broadens as we go then.
Absolutely. Kids in general do very well with COVID. I know a lot of people don't like the comparisons when we say flu comparison or another risk, but I think it's important to put it into perspective. The COVID-19 with children, there are many illnesses that are much more dangerous with kids that we are comfortable. Putting your child in a vehicle and driving with them is actually a more dangerous activity than a child having COVID, from what we know right now with the preliminary data. And I'm not trying to make light of children getting COVID, but that we do sometimes use those comparisons to remind people that those risk behaviors, we are comfortable with taking some risks in our lives. And so that's really where that comparison does, I think, have some value. That being said, there still are a lot of unknowns. There's unknown chronic issues that could come up with this. So we are trying to encourage people to use the mitigation strategies. The small classroom sizes, the masks, and hand washing at school are working very effective to not spread this at the schools. So we want to keep encouraging those activities.
Yeah. Well, it's you and I have, since we started talking about this, everything has always been couched in what seems the way to go today could change 2 hours from now or 2 days from now or whatever. It's an ever-evolving situation until this has been part of our lives for a while. But I continue to appreciate your participation with us. Anything else come to mind before we put a bow on it?
The only other thing I'll add with my bow will be the CDC also and Center for Medical Services just released recommendations for responsible indoor visitation for nursing homes. We are so excited to be able to have some safe visitation for our long-term care residents and are working on doing that. All of these little things, vaccine, getting some visits in the hospital, are helping us feel that move toward normalcy. So we encourage everybody to sign up for the vaccine. We are getting more. We expect to have another clinic available in April, and please encourage your friends, neighbors, and certainly any high-risk individuals to sign up.
Okay, and it's that same system. There's a phone number and then also a web way to get signed up, and that's for anybody now, anybody of any age.
Anybody of any age. Right now, the vaccine, depending on the type of vaccine, is 16 and older.
Right.
We are working to, previously we have not had vaccine available for anybody in that 16 to 18 age group, and we are working to obtain that. So we do want 16 and older to sign up on the Cordova's website. It's on Cordova Prepared. It's on the hospital website, or you can call 424-3045.
Perfect. Well, thank you again for the time and the knowledge, and we hope you have a great weekend, Dr. Sanders.
Thanks. You too.
Dr. Sanders knows the things, which is why we enjoy visiting with her and keeping up to speed on our medical team's perspective on a variety of issues. It does kind of, you get the glimmers of hope that we're definitely on the downhill side of things. Hopefully that will continue to be the case as long as we all remain careful. And your local radio stations will, of course, continue to inform you as we are able in the 1, 5, and 8 p.m. hours. Again, we haven't needed these updates an awful lot, but we keep the time slot open. And then there's always the upload to youtube.com/Cordova TV. By the way, if you ever, tune in and hear our sort of generic announcement, visiting the YouTube channel is always the best way to go back and listen to the most current, what was the last issue that we discussed, kind of a thing. And you can just pull that up on any internet-connected device, and it'll be right there for you. And if you want to go all the way back to the beginning and listen to all of them again, I can't imagine why anybody'd want to, but they're all there for you. So thanks for tuning in. Hope you have a great weekend. And stay safe from 6 feet apart, unless you're vaccinated. And, now I'm confused again.